5 months from the time the first COVID-19 case was confirmed in Rwanda. On March 14th this year, positive cases have increased to over 2,150, with over 750 active cases in 10 treatment facilities across the country. Much as these statistics show improvement in management of the virus, there is also a possibility that new infections might increase overnight to overwhelm the national treatment capacity. This has prompted the government to consider home-based care for patients with suspected COVID-19 who present with mild symptoms. However, this idea has sparked mixed reactions among members of the general public.
Basing on
the lifestyle of Rwandans, this is something they can cope with very well because of the way we have well responded to COVID-19 guidelines. The government would only need to invest in mass sensitization of prevention guidelines, home care for patients with COVID-19, and management of their contacts. I'm sure we can manage.
Coronavirus yandura mu buryo bwihuse cyane.
I think COVID-19 patients should be treated in isolation centers because the virus is highly contagious and it is difficult to manage contacts in a family setup. I would prefer that COVID-19 treatment remains as it is now. On the other hand, community health workers believe that home-based care treatment for patients with COVID-19 presenting mild symptoms is attainable. It is very possible, especially in urban areas where people have been well respecting prevention guidelines. But I think it requires fast and readily available medical service for patients in critical condition should the need arise, and keep those with mild symptoms in the hands of community health volunteers in their homes.
It is
very possible, considering the seriousness of this virus and how it has affected every other sector of life. I trust people will take it very serious, but it would require training for home caregivers and to observe COVID-19 prevention guidelines because the virus is highly contagious. The Director General of Rwanda Biomedical Center, Dr. Sabin Sanzimana, said that the government is set to sensitize the general public on the practicability of the home care for COVID-19 patients.
Turi kubitegura abantu barwaye koko akaba aribo bazajya bashyirwa ahantu havurirwa.
We are working on this in such a way that only patients in critical condition will be taken to treatment centers, while those with mild symptoms will be asked to stay home and self-isolate. That is the journey we are embarking on in the near future. We also want to invest more in communication and mass sensitization of COVID-19 prevention measures, engage youth volunteers more to help in ensuring public adherence to set guidelines. They are already doing a great job, but there's also need for increased personal responsibility. This will help us to defeat this pandemic.
Experts believe
that using community health volunteers in COVID-19 management will go a long way in ensuring that the country defeats COVID-19 as soon as possible. From December 2019, when the first case was confirmed in Wuhan province of China, over 20,300,000 cases of coronavirus have been registered across the globe, and over 740,000 deaths confirmed, including 7 in Rwanda.